Okay, so this is our sleep as a root cause of chronic disease presentation, and I'm Nyla Goldenberg from Functional Endocrinology, and I'm as well a health coach. And sleep is super important for our health, and therefore we are talking about that. So we want to say or spend a little bit time about why sleep is important, some tips on better sleep, what light therapy can do for us, some medications and supplements for sleep. The recommended amount of sleep each night is between 7 and 9 hours, and sleeping less than 6 hours shows about 12% increase in mortality compared to people who sleep 8 hours. And you can see the curves here. For the all-cause mortality, optimum appears to be around between maybe 6.5 and 8. And if you sleep too much or too little, increased mortality. Same appears to be for cardiovascular, stroke, and heart disease mortalities. You can see the total cardiovascular disease, heart, coronary artery, and stroke relative risk was between 5 and 7% more per each 1 hour or less than 7 hours. And sleeping too long increased mortality as well. The sleep fact that I learned from Matthew Walker's book, Why We Sleep, the afternoon nap increases brain's learning capacity by 15 to 20%. And it indicates that having power nap for 15, 20 minutes can help you to process the knowledge that you just learned. Sleep improves your memory and halting forgetting by 30 to 50% relative to staying awake. The book is wonderful. So if you have a chance to listen to the book or read the book, it's knowledge, strong knowledge, because Matthew Walker is PhD from Stanford University, and he provides details about sleep and helps you to understand why it's indeed very important. So not getting enough of sleep increases sweet and salty craving by 30 to 40%. So guess what? What happens when we eat sweet and salty food? We start gaining weight. So maybe all of this last 50, 60 years, we have obesity epidemics because of partly sleep deprivation epidemics. Sleep offers threefold boost on creativity and problem solving. You probably have heard multiple stories where people went to sleep and in a dream they saw the resolution to whatever problem they had, including a periodic table. Mendeleev actually dreamt the periodic table, and that's one of the examples. Good night's sleep improves time to physical exhaustion when exercising by 10 to 30%. That's why elite sportsmen or women do exactly that. They do sleep, they try to sleep, and especially before competition, because it helps your performance, physical performance. So the question for either of you, first, after waking up in the morning, could you fall back asleep at 10 or 11 a.m.? And if answer is yes, you are likely not getting sufficient sleep quantity or quality. Second, can you function optimally without caffeine before noon? If the answer is no, then you are most likely self-medicating your state of chronic sleep deprivation. Again, that comes from Matthew Walker, one of the most noted quote from this book. Again, highly recommend to read that book. Chronic sleep deprivation causes fatigue, as we know. It reduces ability to deal with stress, reduces our attention span, and again, is epidemics of ADD is true ADD, or is it sleep deprivation? And when you are sleep deprived, you apparently tend to have microsleep episodes. And those microsleep episodes can happen randomly. They could be in the middle of driving the car. I actually can say that I've had those microsleep episodes in the past myself, and it could be embarrassing that you are in front of the patient and suddenly you wake up and notice that you did fall asleep. But that's happens because we all can have sleep deprivation. Sleep deprivation causes immune function, and therefore people who are sleep deprived are more likely to have upper respiratory infections. And even during COVID, that was one of the risk factors for sure. During sleep, we utilize a recently described glyphatic system that helps to detoxify brain. And apparently there is fair amount of evidence showing that sleep deprivation is associated with Alzheimer's disease and other forms of dementia. So having enough of sleep is crucial for keeping our brain sharp for years. There's strong evidence showing that obesity, insulin resistance, type 2 diabetes, metabolic syndrome, cardiovascular, dementia, and cancer are all associated with chronic sleep deprivation. And improving sleep will help to overcome those conditions. So sleep is a root cause, or sleep deprivation is a root cause of chronic inflammation and chronic disease. There are causes of sleep issues that people may have besides actual sleep disorders. You could have depression. You could have nocturia, meaning people have to urinate at night, especially if people take pills for example, HF is heart failure, and one of the main treatments is diuretics. Water pills. So if you have taken water pills in the afternoon or in the evening, and guess what? You will have nocturia. Of course, there are other causes of nocturia, and it's important to consider a lifestyle intervention or treatment of finding the cause of nocturia to help and improve sleep. Respiratory diseases, people with different versions of sleep apnea, different versions of COPD, may have impaired sleep for sure. The pain is very big in impairing your sleep. I have patients with chronic pain who have to sleep in certain type of reclining chairs or other chairs in order to be able to fall asleep and stay asleep. And many of them don't stay asleep much. They will sleep for a couple hours, then they need to turn and twist and find another position that could be a little bit more comfortable. Polypharmacy, of course, we have people who have sleep problem and they will take sleeping pills, and then daytime they cannot stay awake, so they will take stimulating pills, and that becomes a vicious cycle. Plus some other medications may affect the sleep too. Parkinson's disease, other disorders that require certain medication that affects the brain. The timing of taking medication is very important to avoid the impairment of sleep. With dementia, sleep is one of things that starts changing very early in the course, and there could be either excessive sleep or sundowning and so on. And we definitely need to play absolute caution with hypnotics, medications that causes people to sleep, because it can impair the function. And GERD, that can affect the sleep, and consider PPIs as a measure, and other lifestyle treatments and supplements that can help reflux disease. And there are, of course, more and more sleep disorders that are described at this point, and they could include insomnias, problem falling asleep, staying asleep, restless leg syndrome, sleep apnea, narcolepsy, night terrors, sleepwalking, REM sleep behavior disorders, and so on. The general workup, I usually make sure that people have normal thyroid and cortisols, because too much of thyroid or too little of thyroid, underactive, overactive, can affect the sleep. Cortisol affects the sleep tremendously, and cortisol can be truly elevated with what we call Cushing's disease or Cushing's syndrome, or just because of stress. Then we want to check blood sugars, because dropping blood sugars in the middle of the night can cause person to awaken. Sleep studies are have to happen, and not only night sleep study but day sleep study are important for proper diagnosis. And of course, you may want to consider all the previous conditions that we talked about: heart failure, Parkinson, depression, and so on, in order to normalize the sleep. So napping appears to be super good, and a lot of people in the United States nap, and 10 to 20 minutes reduces sleepiness, improves cognitive performance, increases alertness, attention, and energy level, improves mood, according to all the studies. And 20 to 30 minutes sharpens memory and enhance the creativity, and you can see all the other timing. So even power naps for 10 to 20 minutes are beneficial. The only thing, avoid taking naps later in the afternoon, because if it's too close to the sleep, you can interfere with your sleep at night. So always plan and prepare your sleep time. Plan to spend 8.5 to 9 hours in your bed if you can, because it takes a little bit time to fall asleep. But if you cannot fall asleep, you don't want to spend time laying in bed and thinking about things and worrying. Going to sleep and waking up at the same time of the every day, it's wonderful, because your body gets used to those timing and creates its own circadian rhythms. Begin preparing at bedtime 30 minutes before going to bed. According to the book I mentioned before, if you can go and take a shower, even if it's a warm shower, it still will allow your body to cool down. And when your body cools down, that stimulates the biochemistry that's required for you to go to sleep. And keeping bedroom cool at night is definitely very beneficial. And for some people, the difference between daytime and nighttime could be up to 10 degrees, but it's maybe different for different people. So having cooler bed, cooler air in the bedroom is very beneficial for improvement of the sleep. Different aromatherapies could be great. And as I said, the bath, when it triggers your body to cool down, and therefore will help you to go to sleep. How to improve sleep? It's to minimize and avoid stimulants in afternoon. So reduce alcohol. And it's interesting, drinking alcohol daytime apparently helps to go to sleep later on. But if you drink alcohol with dinner, that actually reduces your ability to fall asleep. So try to avoid alcohol with dinner as much as possible. Caffeine-containing beverages, of course, finish that by 2 p.m. Stimulants, the same. Complete your aerobic exercise or other strenuous exercises at least 3 hours before going to bed. Avoid large meals or spicy food before bed. when I was growing up, we had the saying that eat breakfast yourselves, share the lunch with your friend, and give your dinner to your enemy. So try to finish eating at least 3 hours before bedtime, but you may have a snack because for some people, having a combined snack, small amount of carbs and protein with good fats can prevent the sugar drop. And carbs help you produce serotonin that turns into melatonin, and therefore that will help you to go to sleep better. And try not to drink more than 8 ounces of fluid before bed. That way your bladder is not going to wake you up in the middle of the night. The light plays super important role because it's part of our circadian rhythm, and that's how our body naturally knows when to sleep, when to go to sleep, when to wake up. Red or near red light therapy for 30 minutes before and 30 minutes first thing in the morning, that's kind of simulation of dawn and sunrise, sunset. That is very good for your body and for creation of melatonin. However, in addition to that, red light therapy can help your mitochondria to detox, and therefore has double improvement, double positive for your body. On the other hand, you may want to consider blue light first thing after the red light, first thing in the morning within first couple hours. So red light, then right away bright blue light, that again will help your body to get the message that there is a daytime, and all of that eventually will help your pineal gland to create melatonin. In afternoon, you want to have maybe amber glasses light and blue light blocking glasses at least 30 minutes before going to bed, but preferably for a couple hours. Turn down lights in your room at least 15-20 minutes before going to bed. That's again tells your body that stimulates sunset, tells your body that's time to slow down. Use dark window shades and consider a set of eye shades so you don't have any exposure to light. And avoid night lights in a room and maybe even technology that has lights on them, because that can still interfere with your sleep, especially if you're a light sleeper. And of course, bedding and pillows are important. Having hypoallergenic pillows, that if you're sensitive, changing pillows and pillowcases frequently, that will be very useful. Consider side sleeper pillow so you are comfortable in a bed. Consider using body pillow to hug and put between knees to align your back and shoulders at night. Roll backwards at slight angle onto your body pillow if you have hip bursitis or shoulder pain. Sleep on highest quality bed linens if you can afford. And for many people, weighted blanket can make a big difference. The noise, for many people, having white noise helps them to sleep. For other people, you may want to use earplugs if you are very sensitive to different noises outside. Turning off and removing any appliances or clocks that make noises is important. And in general, EMF, electromagnetic field, many people are sensitive to that, and therefore having them at least 8 feet away, or if possible, none at all in a bedroom, that will be the best. And for sensitive people, avoiding electrical blanket is very important too. Reduce tension and anxiety, meaning don't watch different news before going to bed, because it's can make you more stimulated. Avoid paying bills before going to bed, arguing, all kind of negative judgments. For some people, writing in a journal becomes better. It's kind of purging and helps you to unload everything, and then you can go to sleep. But in general, scheduling time to deal with whatever troubling thoughts you have becomes a good way to deal, kind of allow yourself to fall asleep now and deal with problems tomorrow. And there are different apps that can help you to do the meditations, calming music, and allow you to fall asleep. If you cannot fall asleep for more than 30 minutes, leave the bedroom, read or do relaxation techniques. Consider reading at neutral light rather than on Kindle or cell phone, because again, that can stimulate your brain and prevent you from falling asleep. Try writing recurrent thoughts if you have something that interferes with you falling asleep. Keep the journal and don't use tablet lamp for reading. Instead, use HUD light or other small reading lights. And then maybe when you are ready, go back to trying to fall asleep. There are obviously lots of medical treatments for insomnia. There are some hypnotics, but they are frequently now associated with increased risk of falling and hip fractures, impairment of cognitive function, and overall higher mortality. So short course could be recommended, but usually no more than 2 weeks. Benzodiazepines are not recommended initially, should only to be recommended as second or third line of treatments. And of course, treatment of comorbidities are important, and you can try to use melatonin, particularly when one set of sleep is the problem. You can try to use melatonin XR that can allow you to sleep through the night, but you have to try to see what works. There are several supplements that could be helpful, and melatonin has a special pathway of detoxing. Kind of it's the same one as for detoxing of warfarin. And as you may know, with melatonin and warfarin, people may require very small amounts. For melatonin, for example, 1 or 2 milligram of melatonin, medium amounts between 5 and 10 milligram, or high amounts between 10 and 20 milligram, depending on your genetic background. And therefore, if you tried 3 milligram and it didn't work, it doesn't mean that it's not working. It means that you may require a lot higher dose. However, if you are sensitive, 3 milligram could be too much, and then you wake up with nightmares and somnolence. It means it's just you are a slow metabolizer for that melatonin, and you need much smaller dose and go back down to 1 milligram. 5-HTP, it could be given at first thing in the morning or at bedtime. Here, the article I found, it was between 100 and 200 milligram. But for many people, 50 milligram could be enough. And I usually try to start with smallest amount possible. 5-HTP is precursor of serotonin that turns into melatonin, and that's how it possibly helps. And 5-HTP being a precursor of serotonin, you have to be careful with medications like SSRIs or SNRIs, because it can lead to increased level of serotonin and serotonin syndrome. I typically check serotonin level to make sure that people are not in the middle or high level, or level to begin with. And if it's not, then you can safely try small doses and see how people tolerate. Taurine is great as well. Magnesium, I like magnesium. Our soils are depleted, and because of that, magnesium is important. And glycinate. So glycine is amino acid that helps us to go to sleep. It's part of precursors of neurotransmitters, and therefore a good supplement for that. Magnesium glycinate has even better. It's magnesium and it's glycinate. Therefore, it helps people with sleep. And usual dose between 100 and 400 milligrams, but can be used up to 800. Some people may have higher cortisol level, not into a range of actual hypercortisolism like Cushing's, but just higher cortisol level because of their overexcitement or stress or whatever else is happening. And therefore, reducing that cortisol helps people to go to sleep. And for those people, we can use ashwagandha, phosphatidylserine, lactum, casein, decapeptide, L-theanine, and they will support that part. Lemon balm, passion flower, valerian root, they are similar to benzodiazepines pathway, or they work through benzodiazepines pathway. So they do support relaxation and sleep onset. So you can try those. The progesterone is great for women. I never tried it for men with sleep issues. There is actually shouldn't be too much wrong to try it, but I haven't seen any articles about progesterone in men. Therefore, we are not going to do that unless it's studied somewhere. There are lots of tracking sleep apps because many people may say, okay, I slept only 1 hour, but most likely they slept a lot. They just woke up a lot. And it's important to know what we're dealing with. Of course, actual sleep study is the best, but poor man's version of sleep study will be all kind of tracking devices that are available right now on the market. And that's it for right now. Thank you very much. And we'll stop the recording.